David Ginsberg, I'm back. We had talked about how MS can impact your bladder. Now we're going to talk about treatment and interventions. So if you remember, what have we talked about? Where can you have problems? You can have bladder problems in terms of you can't store, or you can't empty, or you can have a combination of the two. And there are multiple treatment options for both problem storing and problems emptying. There are empiric therapies, and there's therapies that we have that are based on a variety of studies, whether it may be bladder diaries or urodynamics. And the therapies may be impacted by how severe your symptoms are in terms of your bladder misbehavior, and also the degree of disability and how the MS is impacting you from an overall sense as well. And the most important thing is, your caregiver, I am not the one choosing your therapy. You are the one choosing your therapy. My goal is to make sure you understand your options that are available, and then we're going to work through this in a shared decision-making process, but the person who chooses what's going on next is going to be you. And my job is to make sure you understand the options. So let's talk about this. So the first question is, when should a person with multiple sclerosis see a urologist? And maybe it's when you think this comic strip isn't actually all that funny. So if you can't see that, it says, urology department, can you hold? So for example, if you're having trouble holding the urine and you're having accidents and you're not getting better with medications, that's probably a good time to see me or someone that does what I do. Because if you're having trouble holding, you're having storage problems. So what are your options for storage problems? That's the urgency and the frequency. And maybe that incontinence with urgency because you can't get to the bathroom in time. So one option is always to say, you know what? I'm not bothered enough by this. I don't want to do anything, or I'll wear a pad. My preference is that. We also have behavioral therapies. So what does behavioral therapy mean? It could be working on your diet, eliminating foods and drinks that may be irritating in your diet. Things like caffeine, alcohol, maybe dietary modification. It may be working with pelvic floor therapy and doing pelvic floor exercises. And in my practice, if you want to do pelvic floor therapy, I will ask you to see a pelvic floor therapist who specializes in that. And pelvic floor therapists are wonderful in teaching you how to really work and strengthen your own pelvic floor to help gain control. If you want to be a little more aggressive, not overly aggressive, we have oral medications. And we have a variety of oral medications for these overactive bladder symptoms of frequency, urgency, and urgent incontinence. And if you look at this list, there are two main classes of medications in terms of oral medications. There's anticholinergics, where we have a variety of medications, and we have beta-3 agonists, and there's myrbetriq, and there's a brand new and a newly approved medication called Gymtesa as well. So I think they both work equally as well. I don't think we say one works better than another. And in fact, sometimes we may use both of these classes of medications together. And sometimes when we decide which therapy to use, we're balancing side effects. So what does that mean? So the anticholinergic medications, there are many more of them, and they tend to be cheaper, but they may have some bothersome side effects, such as dry mouth or constipation, dry eyes, or your brain can get a little fuzzy, which we obviously do not like. And for example, on a patient with MS who already has baseline constipation, if we're giving you more constipation, that's not a good idea. We try to avoid that. So maybe we try one of the beta-3 agonists, which again, great option. Sometimes the copay can be a little higher depending upon your insurance, but there's no dry mouth, there's no constipation, no dry eyes, no cognitive issues. In a very small number of patients, you can have a little rise in your blood pressure. Thankfully, that doesn't happen that often. So what are other options? What if oral medications aren't enough for patients that have overactive bladder symptoms? We can try botulinum toxin. This is a therapy that is FDA approved to relax those bladder spasms and give your bladder more time before you feel that urge. and hopefully result in that urgency not being as overbearing and decreasing the amount of urgent continence episodes you have. If you are injected with botulinum toxin, depending upon the dose, it can last anywhere from usually 6 to 10 months, so we have to re-inject you. We do it in the office. It's easily tolerable in the office with local anesthetic. The biggest two risks are infection, and we'll give you an antibiotic the day of the procedure to minimize that risk. And there's a small risk that it may work too well, and you may leave too much urine behind, and you may need to catheterize once or twice a day. Thankfully, at the dose we usually use for patients that are avoiding on their own, that happens less than 5% of the time. What's another option? One would be tibial nerve stimulation. And here's an example of what it is it's based on some acupuncture theories. And we place a very small needle in the ankle, and we stimulate that nerve right there above the ankle for 30 minutes at a time, once a week for 12 weeks. And after 12 weeks, we step back and say, are you better? And if you're better, we would re-stimulate you approximately once a month. We have one other nerve stimulation option that's called sacral nerve stimulation. This is actually done in the operating room with very light anesthesia, similar to, say, the anesthesia you would have if you're having a colonoscopy. It's outpatient. We put a small electrode in the back, lower part of the back, through the skin, onto the nerves directly responsible for your bladder behavior. Or you could say your bladder misbehavior, okay? And this helps. This is an interesting option for our MS patients because it helps those storage symptoms of urgency and frequency, but it may also help bowel incontinence. So for those of you that have both, this may be a very nice option. And we put this electrode in with an external battery for 2 weeks. And if you have a good response, we place a battery, kind of like a pacemaker. Every time with the pacemaker, they have a little battery up in the under the skin, in the upper part of the chest. We put a similar battery in the upper part of your buttock in the back. This was something we never did for MS patients because with this device, you couldn't get an MRI. And we know that MS patients need to get regular MRIs at times to follow their lesions. But we now have MRI-compatible neuromodulation devices. And this has really opened the door for this treatment option for MS patients. And now we actually have two different kinds of batteries. One that lasts about 5 years and does not need to be recharged. One that can last up to 15 years, and you have to recharge it, which means just placing a little charging belt around the lower part of your back and charges it for about 30 minutes a time every 2 weeks. Now, these are treatments for emptying. Now, what if you have storage? What if you can't empty? We can put a catheter in, a full-time catheter, or one that maybe you would pass in and out. So if you look at this picture, this is called a suprapubic tube. This is a catheter that's in this patient, goes to a bag, it's in there all the time, and is changed monthly. And I tend to use suprapubic catheters more for patients that are a little more debilitated, have trouble getting to the bathroom without a lot of assistance, and this may make things easier for them, caregivers, for all involved. The other option for patients that have difficulty emptying their bladder, that are maybe a little less issues with hand function and mobility, is we could teach you how to pass a catheter yourself. Just pass a catheter in and out of the bladder to get the bladder completely empty. And if we do that, sometimes we'll combine it with oral medications or botulinum toxin to really make sure that bladder can hold a lot. And you would pass the catheter once every 4 to 6 hours, and it can be a life-changing issue for folks that have difficulty emptying and incontinence, because we can often resolve those issues. But again, a lot of this is dependent upon what is your problem. Is it an emptying problem? Is it a storage problem? Or sometimes, again, a little bit of both. So to summarize, MS can cause bladder issues with emptying and bladder issues with storage. There are multiple treatments available. How do we decide what treatment is right for you? It's going to be based on your symptoms. It's going to be based on an ultrasound because we have to make sure you're emptying your bladder well. We may do other studies like a bladder diary or urodynamics. Degree of disability, hand function, cognition, all play a role. And again, most importantly, is you understand these options and you can choose what therapy is right for you. And that's the most important thing. Thank you very much for listening and hope you all have a good day. Thank you.